my name is Amanda. I'm the occupational therapist and lymphedema therapist here at Cornerstone. Thanks for joining us for a little chat today. We're going to talk about exercise, different types that you can use when you have lymphedema. So it's important to do exercise to bring that fluid out of whatever area is swollen, because the lymphatic system moves by your muscle. So if you're not moving, that fluid is going to have a really hard time getting out of whatever limb you have that's swollen. So the first couple that are really good are just regular range of motion or decongestive exercise, what we call them. So if your arm's swollen, just, simple raising your arm up and down, raising it up, kind of opening and closing that hand. Do one at a time. Helps pump that fluid out of that arm and hand. If you have leg swelling, doing your ankle pumps. You can curl those toes in and out and leg kicks. And another one is good. You can take your opposite hand, your opposite leg, and you're just going to push down against either one for a little bit and let it relax. That gives the body a little bit of resistance. It's always also very important to do diaphragmatic breathing, or belly breathing is what we call it. You do it sitting up, but it's easier to do it laying down. And what happens is when you breathe in, your belly's going to rise. When you breathe out, your belly will come. So push all that air out of your belly. That's the way I like to say. So other ways, aquatic therapy is really, or aquatic exercise is really good for managing your edema. For one, because that water provides you that compression against your limb. And then the other, it gives your body its lighter weight. It's easier to move around in the water to allow you to move more freely. And you can do the same type of exercise in the water. Walking in the water is really good. Laying on your back and kicking, and then raising your arms up and down, or in and out to the side. You can also bring weights in there, and they have those little pool floaties to give yourself a little resistance. A new researched exercise that's been shown to be good for lymphedema is called rebounding. It's just a tiny little trampoline that you jump up and down on. You can do it gently at first, get a little higher each time. It helps with the gravitational pull on your body. So when you're up and down all the time, that's creating that open and close of your lymphatic vessels to allow it to go back up into out of those areas that's swollen. Resistance exercises, depending on what you did before you developed this lymphedema. You don't go right back into it right away, because it could make your swelling worse. And don't do it if it's painful. Start slowly. So if you're a golfer, don't go out and golf a full 18 holes. Maybe start with a 9 or less. If you're a CrossFitter, start a little bit more on the gentle, a little less weight, and then gradually work your way up. And then there's another one that's been researched pretty well. It's called the Edema method, and it's mostly been researched with breast cancer patients. It's a lot of just gentle motion exercises with the kicking. You do some neck rolls, and then with your arms up and down. It also tells you to use a light resistance. So this is a very light exercise band, but there are other ones out there. You can just kind of pull it apart, punch, and come up. And then if you have leg swelling, even if you have arm swelling, you work on your balance. You can get a little pole, kind of stand there and do some marches, go side to side with it, kicks. But if you needed to, need it for your balance, you can always put it down and do it that way. That's a big variety of exercises that you can start with. And if you ever have any pain with exercise, please stop doing whatever you're doing and see a doctor. Or if you're already seeing a therapist, go talk to your therapist about what type of exercise you should be doing. If it's causing you to have more swelling, then stop, and also go back and talk to your doctor. I hope this information has helped. If you have any questions, please feel free to comment below. And again, my name is Amanda, occupational therapist here.